Hey guys, welcome back to my YouTube channel. Today we're going to be talking about obsessive compulsive disorder. So, before we begin, just make sure that you've already bought your candle from my store. If you want to know more about it, everything is in the description. So, click the link in the description. People with obsessive compulsive disorder always have repetitive unwanted thoughts and irrational excessive urges to do certain actions. So I need you to take note that even if the thoughts that the person is having don't make sense at all, like logical sense, they can exactly stop themselves from doing it. So we only have two symptoms, obsession and compulsion. So with obsession, a person will constantly have upsetting and negative thoughts and impulses, and they'll always be feeling a bit anxious and stressed that whatever they're thinking is actually true about themselves. And if the anxiety that they're feeling whilst they're obsessing over negative thoughts becomes too great, they result to compulsion, which is the second symptom. So compulsion is when someone repeatedly does something to relieve the stress and the anxiety that they were feeling from obsessing over the negative thoughts that I just explained like 5 seconds ago. So if you can go back and if you don't know, so people with compulsions believe that whatever actions they're taking or the rituals that they're doing will prevent bad things from happening. So there's quite a few risk factors for OCD, but I guess, well, maybe there's more, but we don't know much about the risk factors yet. So one would be if you have a blood relative that has OCD, that increases your chances of getting OCD. Then also OCD is sometimes, like, a person can be at a higher risk as well if they already have other mental health illnesses. For example, ADHD, eating disorders, and like so many other different disorders. So that will also put you at risk of having OCD. Moving on to the treatments. OCD can be treated by medication and therapy. So for therapy, we have cognitive behavioral therapy, and then we also have exposure and response therapy. So what the therapy does is it helps the person find alternative ways to deal with the anxiety instead of engaging into compulsive behaviors. And then with medication, they are given antidepressants, and I never really go into the details of the exact pills and all of that,
because we all need to be diagnosed first and all of that. So just make sure that if you feel like you're not okay, you can go to a therapist or a doctor. Well, it's a doctor first, then the doctor will help you out. Okay, guys.
Bye.